and chair of the Metropolitan Board of Health. He will be followed by Rachel Franklin. She is the Health Department's Public Health Emergency Preparedness and Communicable Disease Control Bureau Director. We will also hear from Dr. Julie Gray. She's the Associate Dean of Community-Based Collaboration and Assistant Professor in the Department of Restorative Dentistry at Meharry Medical College. As you know, Dr. Gray, for well over a year, has led the testing and vaccine effort that is now set up at the drive-through clinic at the former Kmart on Murfreesboro Pike. We were also grateful to have Dr. Tama Vandekar, Chief Medical Officer for HCA Healthcare TriStar Division, and Dr. William Schaffner, Professor of Preventive Medicine in the Department of Health Policy, as well as the Professor of Medicine in the Division of Infectious Diseases at Vanderbilt University School of Medicine. Both are here to provide their hospital's perspectives. We'll now begin with Dr. Alex Jahangir.
Well, good morning, everyone. I guess here we are again. Due to the surge in cases in Davidson County, we thought it'd be important to provide an update on the latest COVID data, vaccination and testing efforts, as well as hospitalizations here in Davidson County. Now, today, the number of active cases we have in Davidson County is 4,243. July 4th, we were at 444. That brings the total number of cases in our city from March 7th, 2020 to today to 107,810 cases. Our 7-day positivity rate is now 13.7, and our rolling 14-day average of cases is 358. 7-day average of new cases per 100,000 is at 61.6. But even at that number, we ranked 71st out of 95 counties in the state of Tennessee. Now, between July 13th and August 13th, there were 519% increase in the 7-day moving average. And in the same time frame, test positivity went up 3 times for Davidson County. Hospitalizations have also continued to increase. We currently have 622 individuals hospitalized in Middle Tennessee hospitals, up from 339 2 weeks ago. And in Davidson County hospitals, 306 individuals are currently hospitalized, up for 171. And we now have 996 deaths in Davidson County. And I'm sure we'll soon cross the 1,000-person mark. Now, the good news is today I'm happy to say that 50% of all Nashvillians have been fully vaccinated. And 56% of people have had 1 dose of the vaccine. Now, if you take out everyone that's not eligible, so anyone under the age of 12, that means 57% of all eligible Nashvillians are now fully vaccinated. That is consistent with the national average, and I'm proud of Davidson County and Nashvillians for stepping up. To break it down a little bit further, 51% of eligible Davidson County residents 55 years and under are vaccinated fully, and 74% of the population 55 years and greater are fully vaccinated. Now, these reports that I just said will be posted on covid19.nashville.gov website Mondays, Wednesdays, and Fridays, so we'll continue to keep you posted. Now, with that, I would like to turn over to Ms. Rachel Franklin.
Thank you, Alex. The Health Department is working closely with the Mayor's Office of Emergency Management and our community partners to monitor vaccinations and testing in Nashville. The number of vaccines getting into arms in Nashville has increased. This last week, almost 10,000 vaccines were given in Davidson County, compared to about 7,000 in 1 week a month ago. As you know, last week, the CDC approved a 3rd dose of the Moderna and Pfizer vaccines for those who are immunocompromised. We encourage anyone who meets that criteria to visit vaccines.gov to find the closest and most convenient location and get your 3rd dose. Vaccine is free and readily available at pharmacies, grocery stores, and walk-in clinics across Davidson County. This is in addition to Metro's drive-through vaccination and testing site run by Meharry Medical College and at the Health Department's pop-up clinic sites. There have been a total of 440 pop-up clinics since the beginning of the year and almost 23,000 vaccines given at these events. To find the calendar of our scheduled pop-up vaccine locations, go to covid19.nashville.gov and click on the calendar. These events are all walk-in, no appointment is necessary. We are also offering testing at these pop-up locations without an appointment as well. And finally, the health department is working with Chief Swan, Chief Survey, and others at OEM on a plan to expand testing and vaccinations in Davidson County. More details will be available once those plans are finalized. Now I would like to introduce Dr. Julie Gray from Meharry Medical College.
Thank you, Rachel. Good morning. I am Dr. Julie Gray. I'm the Associate Dean for Community-Based Collaboration at Meharry Medical College, and I've led Meharry's testing and vaccination efforts at Meharry's operated community assessment centers. Today, I'd like to share with you my experience concerning the current state of COVID-19 testing and vaccinations at our Kmart site, which is located at Murfreesboro Road. Currently, Meharry staffs the site daily with approximately 25 to 30 people. We are grateful for the continued assistance of our National Guardsmen and women. Our team works tirelessly to provide free and easy testing, as well as vaccinations for the COVID-19 virus. This process continues to be seamless, organized. The wait time is just about 5 minutes for you to either be vaccinated and or tested. Unfortunately, over the past month, our vaccination numbers have increased, but not nearly to the levels that we would like for them to be. On average, there are approximately 40 to 50 vaccines administered per day at our Kmart site. We're also, as Rachel mentioned, administering booster vaccines. We would like to see these numbers increase, and we encourage those of you who've not been vaccinated to come and do so. Our hours of operation are Monday through Friday from 7 to 1 p.m. because of the extreme heat. Our plans moving forward are to add an additional tent to our drive-through testing center to increase the capacity by 35%, and it should be up by the end of the week. In addition, the addition of this tent is going to ensure that we decrease the existing wait time for our public. Testing continues to be vitally important during this time, and we need to make sure that we continue to have effective testing to make sure to slow the spread of the virus. Our assessment site workers continue to work courageously on the front lines of this pandemic, as we have since testing began in March of 2020. We will continue to vaccinate our community, and we want to make sure that we continue to do this in the same unwavering spirit that we've had since the beginning of the pandemic. We ask Nashville that you continue to stay safe. We appreciate everything that everyone in the community has done for this point. I'm going to turn it back over to Alex. Dr. Jahangir.
Dr. Gray, thank you for that and for all your services the past 18 months. Now, this past weekend, hospitals in Nashville reported 3 deaths among individuals under the age of 40. All of them were unvaccinated. The vaccine has been proven to be very effective in reducing hospitalizations and deaths. Similar to national numbers, Nashville hospital admissions are similar in that about 97% of people admitted are unvaccinated, and a similar percentage of deaths are unvaccinated. The average age of those who are dying is also getting younger. An average of 61 years old here in Nashville now, compared to 76 years old last winter. And that can be directly correlated to those who are vaccinated. Those that are older are almost more universally vaccinated, and that's why the death age is going down. It's very simple. Please get vaccinated. Now, due to the impact of the Delta variant and the unvaccinated and its impact on our hospitals, Today, we've asked Dr. Vandekar from TriStar and Dr. Schaffner from Vanderbilt University Medical Center to discuss the impact on the operations and the response of these hospitals. So first, I'd like to introduce Dr. Vandekar.
Good morning. Thank you, Alex. The past 18 months have been difficult for all of us. The sacrifice, loss, stress, and uncertainty caused by this virus have been unprecedented. We all are ready to put the pandemic behind us, but unfortunately, we haven't been able to do so. And in fact, we are experiencing another wave that is at or higher than previous peaks. A year ago, we didn't have the answer. Today, we have a vaccine solution readily available in our grasp. The time for action is now. TriStar Health is aligned with hospitals in Nashville and across the country in calling for the communities they support to get vaccinated against COVID-19. Our caregivers right now today have patients in our ICUs with machines keeping them alive who wish they had gotten the vaccine. But at that point, it's too late. They and their families are living with regret. It is deeply troubling to our doctors and nurses to watch patients suffer. The overwhelming majority could have been prevented with a vaccine. Our clinical leaders strongly support the vaccine. They have studied the science behind it and believe it is safe and effective. The likelihood of getting seriously ill, becoming hospitalized, or even dying as a result of COVID-19 is greatly diminished if you are fully vaccinated. As Dr. Jahangir indicated, the overwhelming majority of those patients hospitalized with COVID are not vaccinated. In TriStar, we continually review and monitor CDC guidelines and FDA approval processes. We are vigilant around our PPE supplies. We are closely communicating with our medical staff regarding Tier 1 and Tier 2 elective procedures, and we have modified when necessary. We are requiring universal masking for all colleagues, patients, and visitors. We meticulously review oxygen, ventilator, and ICU capabilities. We have made the necessary plans for contingency and crisis standards of care. Loss of life in such extreme situations, where resources are overwhelmed, knowing effective vaccines are easily available seems unconscionable. If you are fully vaccinated, thank you for protecting yourself, your loved ones, and your colleagues. If you are hesitant about receiving the vaccine, we encourage you to seek guidance and discuss your concerns with a doctor or medical professional you trust and not a social media website. Only through vaccination can we move forward to improve more lives in more ways. Thank you. And now I'm happy to turn it over to Dr. Schaffner from Vanderbilt University.
Thanks, Dr. Vandekar. This is Bill Schaffner. Good morning, everyone. I'm going to just reinforce the main messages that all of my colleagues have provided to you this morning. You know, in June, things were looking up. We thought we were getting ahead of this virus and we were on the route to opening up in a new fashion, but nonetheless opening up. And what happened? Along came Delta, a variant of this virus that's just extraordinarily contagious, more contagious than the previous viruses we had dealt with, and one that may be even more serious if you do get infected. Those data are a little bit dicey. So we are now in the midst of another increase in cases. Just in our own medical center, last week at Wednesday, we had 120 patients in our entire hospital system. This week, it's 130. I would emphasize that 13 of them are in children who had to be admitted. And as Dr. Jahangir said, the average age of the patients is lower. As all of my colleagues have said, these patients are overwhelmingly, well over 95% unvaccinated. The vaccines continue to prevent severe disease and hospitalization. It is unusual for a vaccinated person to have to be hospitalized. In general, those vaccinated people who are hospitalized are older and very frail, or they are somewhat younger and have immune compromise. Clearly, these kinds of breakthrough serious infections were anticipated. This is an outbreak, a sustained epidemic among the unvaccinated, which is spilling over into the vaccinated. Fortunately, people who are vaccinated who get ill generally have mild infections that do not require hospitalizations. Just reflect, all of these patients really that are hospitalized, virtually all of them, are preventable. They're preventable through vaccination. I share with Dr. Jahangir the pleasure that, well, now just over half of Nashville-Davidson County persons who are eligible for vaccination, those 12 and over, have received vaccine. On the other hand, I'm also a realist, and I am concerned about the continuing transmission of this virus. And I note that also, although our glass is even over half full, it is still half empty. And I would urge, as Dr. Vandekar said, anyone who has any concern, hesitancy, skepticism, any kind of question about these vaccines, please seek out your healthcare provider, get good information. I would like you to be vaccinated, to start your vaccination series this afternoon. We need people vaccinated. That 56, 57%, I would like to see well over 80%. That's what we need to curtail the spread of this virus. Thank you very much. We're all in this together. This virus is not going to disappear. All going to have to be vaccinated, yes, for our own behalf, but also to make our families safer, our neighborhoods, our entire communities. I would like to see Nashville-Davidson County be the single most vaccinated metropolitan area in the United States. Now, there's a goal worth striving for. Thank you.
Thank you, Dr. Schaffner. As a reminder, if you have questions, please click the button to raise your hand. Also, just as a reminder, the covid19.nashville.gov website is updated Mondays, Wednesdays, and Fridays. So if you want to see the latest data, visit there, go to the dashboard. So we'll begin taking media questions, starting with Blake Farmer. Good morning, Blake.
Good morning. Dr. Vandekar, since we have you on this availability, I wanted to ask you, we've been hearing about sort of the pinch in ICUs, and in particular, when folks need to be put on these ECMO machines for oxygenating their blood. But I'm also understanding that like all over the Southeast, folks are needing that. And I imagine, especially being part of HCA, you all are feeling that. Can you kind of talk about what you all are seeing and sort of where the pinch is with this sort of like, end of the line life-saving effort?
Good morning. Yes, obviously ECMO, which is extracorporeal membrane oxygenation, it's a very complex way that you literally take the function of the lung and you have a machine perform that function outside the body, and then you return the blood back to the patient. So it's a very high acuity process, and it really can only be done at centers that are capable of very high level ICU care. And that contributes to the reason that it's not done everywhere and it's not available everywhere. And so when you talk about the pinch is really just because the level of acuity, the level of nursing care, the level of physician skill that is required for this level of support is really only found at the highest level of care provided, university settings like Vanderbilt, Centennial Medical Center, and some others. And so what we've done at HCA in TriStar, and certainly at Centennial, is try and maximize the ability we have to provide that service. So within that, that means, can we get more staff? Can we get more machines, which we have increased? The Centennial leadership team have done everything they can do to try and get more supplies, more trained staff, Their physicians are doing a tremendous job trying to accept patients from so many various places, even across the country, to be able to put that life-sustaining treatment available. The other thing that complicates this is the folks that go on ECMO therapy, it's not for a day or even a week. Often these patients are on for weeks and months. Again, it all speaks to the front end of the process. It is far better to avoid needing ECMO than to need to be competing for scarce resources at high acuity processes. So to directly refer back and answer your question, what Centennial and others at HCA TriStar have done is they've tried to increase the machines and have effectively done so. And they've tried to increase the highly skilled staffing that it takes to be able to run those machines safely for our patients.
Thank you. Our next question comes from Amanda Chen at Channel 17. Go ahead, Amanda.
Thank you guys for taking my question. This is for any of the doctors here. With kids back in school, and do you feel pediatric hospitalizations could go up? And can you talk about the risks associated with that as we see more and more children continue to go in the hospital?
So I'll take that. Thank you, Anna. So 21% of cases, I believe, in our city right now are under 18. Okay. The good news, if there is such, is that kids typically don't get as ill as adults, but they do get ill, right? Dr. Schaffner highlighted that he said 13 currently are admitted at Vanderbilt Children's, and there's other children's hospitals in our region and in our state that are really at capacity. I think this is a numbers game, right? So as more and more opportunities present for children to get together, such as school, the probability of a very easily transmittable disease, such as the Delta variant of COVID-19, is going to spread. That's why I think so critical for those who are unvaccinated, especially children in school, to be masked. I think I've been very open about my support of the CDC guidelines for that, because while a small percentage of kids do end up in the hospital, if you have more and more children affected, that small percentage is going to be a bigger and bigger number of children in our hospitals. And that's, as a parent of 3 kids, that's devastating for me. More so, when hospitals become full, pediatric hospitals in this case, there's other reasons kids need to go to the hospital. And it's just the cascade of resources becomes harder and harder to provide those other services that children need. So I do have worry. What I also don't think we know fully is what's the long-term impact of a child that becomes COVID positive. Maybe he or she is not in a hospital, but what are the long-term impacts to their cardiac function, to their lung function? Maybe there's some discussion of cognition or brain ability. So I think there's a lot of unknown with children becoming ill with COVID-19. So the best thing we can do is mitigate that. And until there's a vaccine for those under age 12, masks are probably the most effective resource we have. And if you're over the age of 12, I strongly encourage parents to evaluate having their children between the age of 12 and 18 vaccinated, because I think that's a great way to minimize that risk right now. Right now, I believe nationally only 25% of people in that age range, 12 to 18, have been vaccinated, and we want to do better there as well.
Thank you. Our last question comes from Elizabeth Lane at Channel 2. Go ahead, Elizabeth.
Hi, good morning. So my question has to do with monoclonal antibody treatments. Back in March, the Biden administration invested $150 million into bringing this to more communities who need it. I think we're starting to see that come to fruition. For example, in Florida, they've turned Camping World Stadium into sort of a mass treatment site. They're doing 300 treatments a day. And my question is, it's sort of threefold. Could we see a push for massive treatment sites like this in Nashville? Do you think that this would maybe deter people from getting vaccinated if they think that this treatment works so great? And could this be a game changer in terms of helping kind of keep people out of the hospital who, for whatever reason, might still be hesitant to get that vaccine?
Yeah, thank you. I want to start this, if I can first reply, and maybe if Dr. Vandekar, Dr. Schaffner after me would like to respond. monoclonal antibody access in Middle Tennessee is pretty good. I'm very grateful to our large health systems, TriStar, Vanderbilt, Ascension, for making it available. In fact, just last week, I think I referred, I kid you not, four people that I know for monoclonal antibodies. It's a great treatment to use when you become test positive, especially if you're over 40. I believe that's almost anyone over 40 now can use it. There's indications. So if you test positive, speak to your healthcare provider, and he or she could guide you to what you need to do. And I believe the access to that is pretty good here in Middle Tennessee. But here's the one part of your statement I would push at a little bit is we need to highly encourage people not to get sick. And the best way not to get sick is to get vaccinated. So we do have massive vaccination events. We have had them. We've had a lot of access to vaccines. And so we need to keep encouraging that. One bit of information that some people don't know, I know some people have some vaccine hesitancy because they say, well, the current vaccines that are on the market are all under emergency use authorization. The monoclonal antibodies, which have saved lives, which have kept people out of the hospital, are also under an emergency use authorization currently. So it's good for people to know that they're out there, especially as more infections go up, to know how to access them. But please, the message should be, let's get vaccinated to mitigate the need for this. And Dr. Vandekar, and I'm happy to follow up there, Elizabeth, if you like.
Yeah, Alex, I totally agree. First of all, within the TriStar division system, we have at least 3 monoclonal antibody clinics set up, with another 2 that are probably going to be stood up within the week. So it's definitely something that's available. So I would support Dr. Jahangir in his statement that it's something that's done. To your question of people considering, I don't need the vaccine because if I do get it, I can just go to this monoclonal antibody site and that'll take care of it. That's 100% not the way this disease is going to work. First of all, you do have to be qualified to be at risk to receive monoclonal antibodies. And as we discussed at the beginning of this call, we are seeing younger, healthier people who are becoming COVID positive who are unvaccinated. The second thing is sometimes this disease progresses at a rate that is so rapid that once you are admitted, once you are on oxygen, the monoclonal antibody therapy, that is not the appropriate use for that, and you would not be eligible for that. And so you're really rolling the dice if you think that you can avoid the vaccine and it's okay, we have this rescue monoclonal antibody. For what it is appropriate for the high-risk patient that is just newly COVID positive, that would be high risk to advance rapidly to become ill but is not yet in the hospital, it is 100% the right thing to do, and immediately contact your healthcare provider, your doctor, because you want to get there early and get it started early once you become COVID positive. But yes, it's widely available, certainly within the TriStar division and within Davidson County. And no, it is not a reason to not get vaccinated. So thank you, Elizabeth, for that important question.
Yeah, I would just emphasize what my colleagues have said, and just to be clear, monoclonal antibody therapy is designed for people who are just turned positive, are not yet sick enough to be admitted to the hospital by and large. The administration of that monoclonal antibody is designed to prevent the evolution of the disease, the development of the infection so that it becomes serious. It's not 100%. As Dr. Van Care says, not everybody qualifies. There are people who have delayed diagnoses and it's too late for us to give it to them. So it is not a panacea. It is not something you should rely upon. Benjamin Franklin, one of the founders of our country, had it right. An ounce of prevention, the vaccine, is worth a pound of cure. And that's monoclonal antibody and other therapies that are necessary. Please get vaccinated.
Thank you, Dr. Schaffner. Those are all the questions that we have. I would like to thank Dr. Jahangir, Rachel Franklin, Dr. Gray, Dr. Vandekar, and Dr. Schaffner for joining us this morning. And of course, we are grateful to have Amy Lankite from Bridges for the Deaf and Hard of Hearing to provide the ASL services. Thanks, and that concludes today's briefing.